The family reunion invitation arrived 3 months after my double organ transplant. Liver and kidney. Emergency surgery after years of autoimmune disease my family had dismissed as chronic complaining. "You're coming, right?" My sister Vanessa texted. "Mom already told everyone you're doing great now. No more drama." I stared at the message from my hospital bed, still recovering, immunosuppressants making my hands shake. "Great? Was relative when you'd nearly died because your family refused to believe you were sick." "I'll be there," I typed back. My transplant surgeon, Dr. James Morrison, had been clear during my last checkup. "Hannah, your family's refusal to acknowledge your condition for 5 years directly contributed to the severity of your organ failure. That's medical neglect, even from non-medical family members. They just thought I was exaggerating. You were hospitalized 14 times. You lost your job because of the illness. You nearly died." His expression hardened. "That's not misunderstanding. That's willful ignorance." Dr. Morrison was also the director of Metropolitan Hospital's transplant program and sat on the state medical ethics board. He'd mentioned the reunion was the same weekend as the hospital's community health initiative event, held at the same venue, different ballroom. "Interesting timing," he'd said carefully. The reunion was at the Grandview Hotel, my extended family packed into the garden ballroom. Aunts, uncles, cousins I hadn't seen in years. Everyone wanted to celebrate Vanessa's engagement to a surgeon, the family's golden achievement. I walked in carefully, still weak, my surgical scars hidden under a long-sleeved dress. "Hannah." My mother rushed over, all smiles for the relatives watching. "You look wonderful." "I told everyone you were fine now." My Aunt Carol approached, wine glass in hand. "Your mother said you had some health issues but you're all better. What was it, chronic fatigue or something?" "Autoimmune disease. I needed a liver and kidney transplant 3 months ago." She laughed. "Oh, Hannah, always so dramatic. Transplant? Really?" My mother's smile tightened. "Hannah tends to exaggerate her medical situations. You know how she is." I felt the familiar anger rise but stayed calm. "I have the surgical scars if you'd like to see them." "Not at Vanessa's celebration," my mother hissed. "This is her day. Can you please not make everything about your health drama?" My father joined us, putting his arm around my mother. "Hannah, we're all glad you're feeling better. But let's focus on your sister's good news. She's marrying a successful surgeon. Real medical professional." The implication hung in the air. "Unlike you with your fake illnesses." Vanessa floated over in her designer dress, her fiancé Dr. Bradley Chin beside her. "Hannah, you made it." Brad was just telling everyone about his surgical innovations. He's pioneering new cardiac techniques. "Congratulations," I said quietly. Brad barely glanced at me. "Thanks. Vanessa mentioned you had some health stuff. Good you're past that." "I had a double organ transplant 12 weeks ago." He raised an eyebrow. "Really? You look fine. Must have been elective or something minor." My cousin Jessica laughed from behind us. "Hannah, you've always had some medical emergency. Remember when you couldn't come to my wedding because of severe pain? We all knew you just didn't want to come. I was in the ACU that weekend. Kidney failure." "Sure you were." Jessica rolled her eyes. My mother took my arm, steering me away from the group. "Enough. You're embarrassing yourself in this family. Everyone knows you exaggerate. You've been doing it for years." "I almost died, Mom." "Oh, stop. You're here, aren't you? You're fine." She glanced around at the relatives. "I will not have you ruining Vanessa's day with your medical drama. If you can't be supportive, maybe you should leave." I pulled my arm away. "You know what? I think I'll stay." Dinner was worse. I sat at the far end of the family table while everyone toasted Vanessa and Brad. My Uncle Tom, a hospital administrator at a different facility, stood to give a speech. To Vanessa and Brad. 2 successful young professionals building a future. Not like some people who use medical excuses to avoid responsibility. He glanced at me meaningfully. Laughter rippled through the room. My Aunt Marie leaned across the table. "Hannah, honey, when are you going to stop playing sick and get a real job? You're 32. Time to grow up." "I lost my job because I was hospitalized constantly for 5 years." "Convenient excuse," she said, sipping her champagne. My mother stood, glass raised. I want to thank everyone for supporting Vanessa through the years, especially during difficult times when family issues, she looked at me, created unnecessary stress. But we persevered. The table applauded. I felt my phone buzz. A text from Dr. Morrison, Health Initiative event ending. Heading to your ballroom. Board members want to discuss community medical neglect cases. Gave them your family's name as case study. Hope that's okay. My hands trembled as I typed back. More than okay. My father was speaking now. Vanessa never let setbacks distract her. She focused on success instead of making excuses. That's the difference between winners and, he gestured vaguely in my direction, everyone else. More laughter. I have chronic autoimmune disease, I said quietly. That's not an excuse. That's a medical diagnosis. Diagnosis from who? Brad scoffed. You doctor shop until someone tells you what you want to hear. Classic Munchausen behavior. My stomach dropped. Vanessa's surgeon fiancé was accusing me of faking illness for attention. I have medical records. Everyone has medical records, my mother interrupted. Doesn't mean you're actually sick. Just means you convinced some doctors to run tests. I had a double organ transplant. So you say, Aunt Carol muttered. Convenient we never saw you in the hospital. Because none of you visited. I sent you the room number 14 different times. We're not enabling your attention-seeking behavior, my father said firmly. This family has made it clear. We don't reward drama. The ballroom doors opened. Dr. James Morrison walked in, followed by 5 people in business attire. I recognized 2 from hospital board meetings where I'd been asked to discuss patient advocacy. The room went quiet. Good evening, Dr. Morrison said, his voice carrying across the ballroom. I apologize for interrupting. I'm Dr. James Morrison, Director of Metropolitan Hospital's transplant program and member of the State Medical Ethics Board. My mother's face went pale. We've just concluded a community health initiative event in the adjacent ballroom, focusing on medical neglect in families. He looked directly at my family's table. We're documenting case studies for a public awareness campaign about the dangers of dismissing chronic illness. My father stood. I'm sure this can wait. It can't actually. Dr. Morrison gestured to his colleagues. This is Hannah Chen's family, correct? The patient we've been discussing? Vanessa's mouth fell open. One of the board members, Dr. Sarah Williams, stepped forward with a tablet. Hannah Chen. Age 32. 5-year documented history of severe autoimmune disease. Hospitalized 14 times. Family contacted each time, attended 0 visits. Emergency double organ transplant performed 12 weeks ago due to complete liver and kidney failure. This is private medical information. My mother started. Hannah signed full release forms for this presentation, Dr. Morrison said calmly. She's helping us demonstrate how family medical neglect accelerates chronic illness to life-threatening levels. Brad's face flushed red. Now wait a minute. Dr. Bradley Chin, another board member, Dr. Robert Kim, said, consulting his notes. Cardiac surgeon at St. Mary's. You're engaged to Hannah's sister and told your colleagues at a medical conference last month that Hannah had Munchausen syndrome, despite never reviewing her medical records. That's defamation and professional misconduct. Brad's eyes widened. Dr. Williams continued, her voice measured but firm. Hannah's medical records show a clear pattern. Worsening symptoms, repeated hospitalizations, family refusing to acknowledge illness severity. Mrs. Chin, she looked at my mother. You told hospital social workers on 3 separate occasions that your daughter was faking for attention, despite documented organ failure. My mother sank into her chair. The family's pattern of neglect is well documented, Dr. Morrison said. Hannah was denied transportation to critical appointments. Family members told her employers she was unreliable, rather than seriously ill. Extended family members spread rumors about Munchausen syndrome without any medical basis. Uncle Tom stood shakily. We didn't know it was that serious. You were notified 14 times by hospital staff, Dr. Kim said flatly. You're also a hospital administrator, Mr. Chin. You, of all people, understand medical documentation. Yet you publicly mocked your niece's medical excuses while she was in organ failure. The color drained from Uncle Tom's face. This case will be featured in our state medical board's public awareness campaign about family medical neglect, Dr. Morrison continued. We're partnering with patient advocacy groups to highlight how dismissing chronic illness can be fatal. You can't do this, my father said, his voice shaking. This is defamation. It's public health education using documented medical cases with patient consent, Dr. Williams corrected. Everything we're presenting is factual and verified. Hannah nearly died because her family convinced her she was exaggerating. That's not defamation. That's documented neglect. Vanessa was crying now. This is my engagement party. And we apologize for the timing, Dr. Morrison said, though his tone suggested otherwise. But Hannah was released from post-transplant care only 6 weeks ago. She's here celebrating your engagement despite barely surviving surgery. The contrast seemed relevant. Dr. Kim pulled up images on his tablet, turning it toward the room. These are Hannah's medical records. Emergency room visits. ICU admissions. Organ failure documentation. Surgical notes from her transplant. The doctor showed everything. My scars, my pain, my long fight to live. The transplant lasted 11 hours, Dr. Morrison said. Hannah's organs were badly damaged. We almost lost her twice. Her family was called. No one came. My mother whispered, we thought she was exaggerating. She was dying, Dr. Williams snapped. Your neglect was recorded in her charts. It's being reported. The room went silent. Hannah's case will be published next month, Dr. Kim added. Anonymous, but it will show how dangerous family neglect can be. Brad spoke softly. I'm a surgeon. I understand. You diagnosed her with Munchausen without even examining her, Dr. Williams said coldly. That's malpractice. The ethics board has been notified. Brad's face turned pale. Dr. Morrison sighed. Hannah's alive today because of the transplant and skilled surgeons. No thanks to her family. He looked at me. Your next follow-up is Tuesday. You're doing great. Thank you, doctor. The doors closed behind them. Silence filled the room. Mom stood up. How could you do this? Embarrass us like that. I almost died, Mom. 14 hospital stays. You didn't visit once. We didn't think, you didn't care, I said quietly. Dad's hands shook. Your uncle could lose his job. Brad's career, that's not my fault, I said. You ignored me when I was dying. Vanessa cried. You ruined my engagement. I had a double organ transplant 12 weeks ago, I said steadily. I'm here because of doctors, not you. I didn't ruin anything, I just stopped hiding the truth. Aunt Carol whispered, we didn't know. You did, I said. Doctors told you. Nurses told you. You chose not to believe them. I walked toward the exit. Where are you going? Mom called. Home, I said. Doctor's orders. I paused. Congrats on your engagement, Vanessa. I hope your new family treats you better than mine did. The fallout came fast. Uncle Tom resigned before the investigation ended. Brad and Vanessa broke up 3 weeks later. My parents cut contact. It was a relief. But something good came from it. The medical board started a campaign about family neglect. My story helped other patients speak up. Dr. Morrison became my mentor and friend. He helped me find a job in patient advocacy. 6 months later, I was healthy and working again. One day I got a text. This is Jessica, your cousin. I looked up your illness. I'm sorry. I should have believed you. I typed back, thank you. That means something. It wasn't full forgiveness, but it was a start. A year after the surgery, Dr. Morrison invited me to speak at a medical conference. On stage I said, neglect doesn't always come from doctors. Sometimes it comes from family. But healing means finding people who care, and knowing your life matters. The doctors believed me when my family didn't. They saved me. And I finally understood, family isn't just blood. It's the people who show up when you're dying and fight to keep you alive. Dr. Morrison was right. I survived. And now I'm building a life with people who believe in me. Because health isn't drama. It's survival.